National Cabinet, of course, wasn't scheduled to meet until February. However, due to the rising COVID cases and the emergence of Omicron in the country, the Prime Minister called an emergency meeting with state and territory leaders. That was on Monday and it did take place today. Now, since cases began to rise and state borders began to reopen, there have been growing calls for restrictions to be reintroduced, including from the Chief Medical Officer. The meeting today focused on three key areas: public health, social measures, the vaccination program to administer boosters, and TTIQ, test, trace, isolate and quarantine. The leaders and medical experts have agreed on the below recommendations to combat rising Omicron cases. Firstly, we have indoor masks. Indoor mask wearing is highly recommended, but the Prime Minister has ruled out mask mandates, saying it is a personal responsibility. Vaccines. The Prime Minister says we need to get back to those record levels during the peak period of lockdown. He has asked for state-run clinics to be ramped back up. They have also sought further advice from ATAGI on where the booster program should be focused and whether there is room to move booster doses further forward. We must have a common definition as well across the country of what is a close and casual contact. Now, he has asked for uniformity across the country on quarantine and testing requirements for those close and casual contacts to eliminate further confusion. So for more on this now, I'm going to bring in political reporter Trudy McIntosh and Brisbane Bureau Chief Adam Walters. Good afternoon to you both. Trudy, I'm going to start with you. Of course, that press conference has just wrapped up. We have just heard from the Prime Minister there. Look, I think one of the key messages to come out of this was the PM's message: stay calm, get your booster. We are not going back into lockdowns.
And interesting to hear from the Chief Medical Officer too, Julie, about the severity of Omicron. We hear so much about this new variant in the last few weeks, but Professor Kelly confirming there's only one case we've had in that time of someone in ICU with Omicron, and so far, thankfully, no one has died with this. Scott Morrison's message has been throughout the pandemic for people to stay calm, listen to the advice that they're hearing. There is crucially, though, a few areas there where it seems the Prime Minister's frustrated with state premiers, particularly that one around holiday testing. Scott Morrison making it pretty clear it's not the federal health advice. This is coming from premiers in Queensland, South Australia, Tasmania, the Northern Territory as well, insisting that people need a test 72 hours before they arrive if they're coming from New South Wales, Victoria or the ACT. It's pretty clear today that's not the federal health advice. He's hoping for a breakthrough, but pretty clear that's not going to happen until the new year.
All right, well, as I mentioned, there were three key areas that were agreed to focus on, those being public health, social measures, the practical things such as mask wearing in indoor spaces, washing hands, social distancing, all the behaviours that we've had in place for almost 2 years now, the vaccination program and the test, trace, isolate, quarantine situation. Trudy, I'll ask you first of all, the PM has fallen short of mandating masks. The Chief Medical Officer says we need to wear them, but they are not being mandated.
This was a pretty awkward moment, really. He's standing alongside the Chief Medical Officer who we'd seen in documents that had been leaked ahead of National Cabinet, provided written advice that he believed masks should be mandated in indoor settings across the country to try and stop the risk of Omicron spreading. Scott Morrison had made it clear ahead of National Cabinet he does not believe in mandates. People should be using their common sense here. Professor Kelly not saying explicitly today, standing alongside the PM, that he'd like to see it mandated, but it looks like that's what we've seen in a lot of states and territories anyway. The ACT moved ahead on this yesterday, Julie. Tasmania had already done it, so states are kind of charting their own course here.
Adam, concerningly, the PM is saying that we don't have to mandate people wearing hats and sunscreen in summer, but in Queensland, the Premier made amendments to masks prior to today's meeting.
That's right. From tomorrow, you'll have to wear a mask in a cinema or a theatre. They've been made mandatory in shopping centres. So there's an example of what the Prime Minister referred to as the unilateral action of a state making its own arrangements. And you can understand why this is causing so much confusion for Australians. They live in a borderless world, national news bulletins, social media, but it seems the jurisdictions become relevant when it comes to these regulations that run their lives. And it's creating a lot of anguish, and maybe it's not necessary. It was put to the Queensland Chief Medical Officer today that with such encouraging numbers, just 0.06% of the 34,000 people tested in Queensland in the last 24 hours had symptoms of COVID, and they were mild to non-existent. Now, when we questioned the Chief Medical Officer about whether that was in fact good news, he wanted to focus on the worst case scenario modelling, saying that the potential was frightening and that if these measures weren't taken now, that those fears might be realised. And that seems to be the argument between the states and Canberra. Scott Morrison, as we saw, very bullish about the vaccination program, about the booster shots, about the need to get on with life. The state's taking a much more cautious approach, and Queensland will stand on its record. I mean, they had 7 deaths throughout the pandemic before the border was reopened, and Premier Anastasia Palaszczuk is maintaining that ongoing tough measures are needed to protect everybody in this state, whether they're visiting or living here.
Trudy, we heard from the Prime Minister say that he really wants to lift that daily rate of vaccinations. The booster shot, that third vaccination, is about 100 per minute. I went and had mine this morning at one of the max vaccination hubs here in Sydney. He's also increasing payments for pharmacists and GPs, $10 a jab incentive, just to keep the pace of this booster rolling out. But he wants those mass vaccination hubs open again, doesn't he?
And the reason why it's been increased, Julie, is actually backlash we'd seen from the Pharmacy Guild and the Australian Medical Association. So the government has been providing this subsidy for GPs and pharmacists to administer vaccines throughout the pandemic, but it was pared back for the booster shot. So this is bringing back some of that money. The Pharmacy Guild had made it clear prior to this that pharmacies were pulling out of the program because it wasn't financially viable for them to continue doing this. So I'm sure the pharmacies will welcome that change. Interesting on boosters, though, we haven't seen a change today in terms of fast-tracking that. ATAGI, the immunisation advisory body, it was revealed, is meeting as we speak, so we could actually get a decision on that today or tomorrow. So watch that space on whether we do see a change on the booster.
Adam, I know you touched on it briefly before, but how are vaccination rates in Queensland? It's been astonishing. More than 257,000 people have crossed the border into the Sunshine State. We have missed your part of the world, but how are testing numbers going?
Pretty good. They hit 90% for first dosage today. They're sitting around 84% for double dosage. So, of course, Queensland's going to lag the other major states in terms of reaching that 90% double vaccination mark and indeed realising the potential for the booster rollout. They're talking about mid-January before 90% is reached. In the meantime, anybody who visits here is being subjected, as we know, to very strict conditions, that PCR test 72 hours before they leave, which is going to be replaced from the 1st of January by a rapid antigen test. That's already had its critics, by the way, because it's believed its success will depend on an honour system. And we've already seen a similar process fail with what was supposed to be a mandatory day 5 COVID test for those people travelling here. But there are tens of thousands of people from the so-called hotspot states of New South Wales and Victoria and the ACT who have not had their COVID status monitored since they've been in Queensland. So it's a concerning situation for Queenslanders. They had a Premier telling them only a month ago that the federal government was wanting to give Queenslanders COVID for Christmas. So they've had to deal with this very emotional language, fear-mongering according to some, and now they have this flood of people from the southern states as the headlines continue to be dominated by this new variant. It's not a comfortable time for Queenslanders going into Christmas and the New Year. They love being a host to the rest of Australia. It's our #1 domestic tourist destination, but it's coming with a fair degree of anxiety.
Well, Adam, the Prime Minister said 20 to 25%, or 1 in 5 or 1 in 4 of those lining up for tests in other parts of the country, they're wanting to travel to other states, which is therefore redirecting resources away from where it's needed most. But the Queensland government has denied that strict border measures are causing these delays in cities like Sydney.
Well, that's right. Anastasia Palaszczuk awoke this morning to accusations that her strict border policy was undermining the Queensland tourism industry, and we all know it needs all the help it can get. We're talking about job losses in the range of 50,000 this year alone, an economic impact of $20 billion on the Queensland economy. So Anastasia Palaszczuk gets straight on the phone to her counterpart in New South Wales, Dominic Perrottet, who confirms that the queue of people wanting a COVID test can't be blamed on Queensland, that only 10% of people on that queue are wanting to travel to the Sunshine State. And Anastasia Palaszczuk was breathless in reporting that to a news conference, a rather heated news conference in Brisbane this morning.
All right, well, we do have to leave it there. Trudy McIntosh and Adam Walters, thank you so much for your update this afternoon. We certainly appreciate your time.